Hello, my name is Ofelia Madrigal, and this is a video for my class. I have it here. Assessment and treatment for sex and disorders and other disorders. So the topic that we're going to talk about today is pretty much, I'm just going to answer some questions. One of the characteristics that best define the role of the therapist is that that we must be active listeners. And when it comes to topics in regards to sex, I believe this is the greatest tool that as a therapist can have. So moving forward, I'm going to answer the first question, which is, what is unique ethical, legal, and professional challenges that I do expect to confront in the role as a therapist and working with sexual questioning clients population? So as I mentioned it before, it's important to be an active listener so I understand exactly what the client, the problem is and what need he's trying to meet. However, there are some limitations as a counselors that are determined by the level of experience and my expertise. So, so if at any moment I do feel that there is some, limitations in regards to my that knowledge in regards to this topic, I'm always willing to refer the client out. However, I do everything within my hands to help the client. So some of the ethical issues or challenges that we might expect to confront as therapists is one of this is the counselor as in client's confidentiality. So according to the American Counseling Association, with the exceptions of counselors, are expected to keep the information shared during the counseling confidential and not inform or don't share with other people in regards to the information that was provided by the client without a prior permission from the client. Another one is the imposing values, the code of ethics, supported by the American Counseling Association, discourage the act of imposing personal biases and limiting in counseling into the clients. In other words, I might have my own values and my own beliefs, and the idea is not to impose those values and beliefs to my client because it's not about the clinician, it is about the client. Another thing is that counselors practice with ethos, indicating that they should do not harm the client. So the intention of the therapist is to benefit the client and help them solve the problems, not adding more problems to the client's problems. Have appropriate boundaries. Psychologists adhere to boundaries and never cross the line of the professional therapeutic relationship. So they must maintain appropriate personal distance. Acceptance, being not judgmental and accepting are important attributes to any of the helping professionals. So, but professional counselor must be able to start where the client is. In other words, we need to consider that the client is in a state where he might be vulnerable, he or she might be vulnerable. So we must be aware that they might need for the therapist or the clinicians to be, to show more consideration and not have a non-judgmental attitude during the treatment. So moving to the next questions, what steps may you employ in order to assure that both your client and you share and understand of your client's experiences and concerns? So the listener, in this case, that would be the clinician, must respond to the client in a manner that is appropriate to the client. It would be in a non-critical acceptance of whatever the client is saying. That's why it is important for us to be active listeners. an awareness of the importance of the moment. So it is important to be in the moment, to stay on the moment, so we are able to walk like the client step by step and meet the client where he or she is at. Another thing is that we can, as a good listener, we are able to grasp what is being said and understand that there might be some incongruences between what the client is saying and what the client's physiognomy is saying. So finding some congruency is one of the characteristics of a clinician's abilities to be an active listener and understand that what the words are saying might not necessarily reflect what it is going on. We can show interest in hearing what the client has to say. Moving to the next question, how made you assure that you're capable of being an empathetic and non-judgmental counselor when discussing the intimacy surrounding sexual behavior? I think that's a great question. So going back, we need to be listen. We need to be able to listen carefully to what the client is saying and the words that they're using, so we can match their vocabulary. We need to allow them to get it all out, give them that moment to share, show respect, show that understanding them is one of our priorities. And I ignored the phone. And I have to give the client the time, give as a therapist, give us time to think. We don't have to respond immediately. That means that we don't necessarily need to be reactive, be proactive. So that might mean that we also have to give ourselves some extra time to think before we answer. And I think one of the factors that I believe that it is very important is that we as a clinicians need to be in a good place mentally, emotionally. So we are better able to connect with our clients and to pay more attention to the need of the client. And this way it is less likely. So if we are not in a good place, then it is less likely that we're gonna make errors, right? Or violate any boundaries. So what are the steps that I will consider in order to ensure that professional boundaries are maintained in the practice as a therapist? So one of the things, the steps I can take is to assess my own personal boundaries, to communicate clearly, to keep my relationship professional, to set clear expectations of what the client, his behavior, and it must be done at the beginning. What is their role as a therapist and what are the limits? I think it's very important to be assertive and let client know when they are behaving inappropriately. Avoid sharing unnecessary information. So we must remember that it is the client's session, is not the time for therapists to share about their own intimacy, right? Details. And of course, able to understand able to know what are our own triggers, so we don't get triggered by the client's experience. So the last question, when working with clients presenting sexual challenges, what hidden concerns would you expect to confront in this regard? I think that the best thing to describe this is that the question that I will ask myself is, did I do well? Am I helping the client? So I believe that using the right word could be my greatest challenge. I often stumble over the vocabulary or the words that I'm gonna use to describe what I'm trying to say. So I believe that my task would be to find the right words, and pronouncing them correctly can definitely be intimidating and somehow limit the best of my abilities to help client. However, I realized that I feel more comfortable about reading the words and reading this information than saying them out loud. So I'm very grateful to be in this class because I'm pretty sure that I'm gonna learn a lot and I'm gonna become confident with using these words and saying them out loud. And I'm very grateful to be here because I am a learner by nature, and I would like to learn a lot and get any all the help that is out there for me to be able to be an asset for any agency that hires me, and also be able to help the clients closing the gap from where they are to where they want to be.